have good news. Some time ago, one of my followers reached out to me to say she has been pregnant for a long time, now for months, if not more than a year. The husband also reached out to me to like verify if there was any possibility that she could put to bed that there is no sign, no ultrasound is picking. And most of the clinics she's been attending to, she's been labeled like maybe she's psycho or something. So there'd been nothing to prove that she's actually pregnant, and they've been really depressed. You understand this feeling that you're getting kicks, you feel like you're pregnant, you're getting all the symptoms of pregnancy, and then your test is negative, the scan is negative. Everybody tend to feel like you are crazy, like you don't know what is going on with you, or you are lying. So I actually encouraged them. When they reached out to me, they were like, is there a hospital we can attend? Is there a hospital where they treat cryptic pregnancy? Is there a hospital where we can be attended to, like at least my wife can get treatment? I said, the fact is there is no hospital where they treat cryptic pregnancy. The only thing I will advise you to do, I will advise your wife to do, is that she should be eating healthy, she should be taking the normal vitamins for ferrobin plus and the normal vitamin, and then be eating healthy to make sure that she avoids stress and all that. I just spoke with them like that because I felt like there's nobody who is going to believe you. No matter what you said, nobody's going to believe that yes, you're pregnant because your test is negative. So I just encouraged them, and then we let it be. But I make sure to tell her to make sure she's doing the right thing and she's taking all her vitamins. And just few days ago, they reached out to me. And guess what? She has put to bed. Like, I am very excited. She has put to bed. You know, the message, Diamond B, yeah, you are not at all. You're not crazy. Like, you're not. Like, the husband wrote me, I was like, glory be to God, my wife has put to bed. I was really shocked. Like, I was like, God, like, this is real. Like, this is real. The fact is, this pregnancy is rare. Like, a lot of people might think that you are saying something that is non-existent, but as a woman, most times you own your body. You know exactly when things are not right in your body. You know when something is off. And most times maternal instincts are very strong. Like when a woman say, I think something is going on. So that's it. Yeah, she did. In fact, out of excitement, I could not really even begin to ask him. I had to just congratulate them. She actually had the baby. She has put to bed. In fact, it was the husband who wrote me to say the wife has put to bed. So, like, I was like, oh my God, I'm so grateful to God that at least I was able to encourage them. Because most times when people reach out to me, I talk about this. Most of when they reach out to me, they are already at their last point, like at their lowest moment. Like, I don't know what else to do. Even if it is not cryptic pregnancy, I always try to find a way to make them understand that this can actually happen. It's a possibility. Thank you, Diamond B. I am definitely going to be extending all your congratulations to them. I still have other women lined up who are still in this similar situation. And as the testimonies unfold, I am going to be bringing them here. I am so excited for them. I am so grateful to God for them that at last all they went through was not in vain. So this is my encouragement to every woman who is in this similar situation. Just make sure you hang in there. Keep your head up high. Don't feel like something is wrong with you. Don't feel that way. All right. Where if I always tell them, I said, do the right thing, make sure you're eating healthy. Just assume that you're carrying your baby, even though test is not saying it, and make sure you're doing the right thing. You avoid drinking, smoking, all those things that will be detrimental to the health of a baby, because you are expectant, even though other persons might not see it that way, but you see it that way and your system sees it that way. So you need to make sure that you're acting based on what you feel, and you do the best to make sure that your child is okay. Thank you, Diamond B. Thank you so much. Thank you so much. So you make sure that you do the right thing so that by the time it's actually a baby that's going to come, that child is going to come with the right weight, is going to come with the right abgas call and everything. Okay, most times the fact that these women do not know there's a pregnancy, the child mostly comes out with low birth weight because they don't get all the nourishment they're supposed to get. Because you might not be attending antenatal clinics, you might not be going for checkup, you might not adjust your diet to suit your condition at the time, which is pregnancy. And so you will discover that the child will just suffer. Like, you give birth and the child has low birth weight. So if you feel pregnant at any point like this particular family, just make sure that you be yourself and do that. Just do all the things that you know that are right. Okay, eat the things that you know that are okay, and don't allow anybody to like kind of um make you feel less of human, because this is not the first testimony I am getting. Like, this one is recent, that is why I'm bringing it. Like, she just put to bed. I'm so excited. You know how I feel, you understand, because there are so many in such situations. The other one was since 2020 that the situation has been on, and this particular person that just put to bed has been for a long time. So I just feel so excited. I think it's about 13 months or even more. Like, it's more than a year. So it was actually a really difficult situation for them. All right, because for the husband, he said everybody keeps saying it's not true. How can you be pregnant for more than a year and there's no test is showing, no scan is showing anything? Like, it was more like she was tagged insane. She was tagged like she was having a problem. So when I began, I said, when they reached out to me, I just had to give the sincere advice I give to everybody, and that's to make sure you're living healthy, you're eating healthy, and doing everything healthy. And now they have put to bed. So I'm just very excited. So I want to encourage everyone, whether you feel pregnant or not, as a woman in your childbearing age, if you're trying, you know that you're trying to conceive, you need to live healthy. If smoking, use of alcohol, no, and make sure that you maintain a very healthy weight. Don't be too obese and don't be underweight, just moderate weight. Eat healthy fruits, vegetables. Make sure you can take lots of water instead of carbonated drinks. And one other thing that you can do is to make sure you're taking your folic acid every single day. Every single day, don't forget to take that folic acid. It's very important, especially if you're beginning to advance in age, because I keep saying, like, the egg quality is not going to be good or remain the same every time all your life. From puberty, you discover the egg quality is higher. As you begin to advance, 20, in the early 20s is still very okay, and late 20s, and then you come to your 30s, early 30s, and the rest, you discover that the more you're advancing, the more the quality of the egg is diminishing. So the quality is not going to remain the same. So the possibility of giving birth to children with chromosomal abnormalities, all the different birth defects, the trisomy 21, and others like Down syndrome, and the rest of them becomes higher. So what the folic acid does is to help prevent some or reduce the effect of some of this birth defect. So when you're taking it, it kind of increase your chances of having healthy babies. So if you have the intention of giving birth, just make sure to be taking your folic acid every day. You can be taking the vitamin B, whether B2, B12, vitamin E, and then also the cod liver. Is it cod liver oil? That's the omega-3 fatty acid. I think it's more in fishes like the salmon fish and the different kinds of fishes. You can get them from meat. So you try as much as possible to live healthy and then exercise from time to time. Now, what exercise does is that it helps blood to flow all through your body. As you're exercising, the heart is pumping, and so it's distributing a lot of blood to your entire system, and it's distributing also to the reproductive system, the womb, and also the other part. Okay, Diamond B, you're asking if it's possible to go the normal 9 months. Of course, that's the fact. Of course, you can go the normal 9 months. Like the first case we had, the first case that happened in Enugu, Nigeria, it was just about 9 months because for that lady, the last time she actually had an unprotected contact with her partner was about 9 months before. Okay, and that was it. And on by the time she gave birth, it was just the normal timing, like it's the normal timing. So usually you can go the normal 9 months, but sometimes due to the position of the baby and all that, and like I said, most times it is not picked up due to the position and shape of the uterus. So you discover that the pregnancy can go more than the 9 months before it is delivered. But that is does not mean that the 9 months is not still normal for it. So the first testimony we got was actually 9 months. Like from the time she knew she had an unprotected contact, it was like 9 months before she eventually had her child. But in her own case, she was just a normal student, a regular student that was in um in the secondary school. She was in a boarding school. Okay, so there was no she was getting her period, so it was difficult for her or her family members to know she was pregnant because she was always attending the school clinic, and the complaint was always tiredness and fever. Like she feel generalized malaise, that's generalized weakness, tiredness, and then sometimes fever. So each time she gets to the school clinic, the medical officer there is always treating her for malaria, because if you're around the African region, where in Nigeria, you're sure that mosquitoes are everywhere. So the first thing that will come to the mind of anybody if you bring a complaint is malaria. So they were just treating her for malaria, 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 and that continued. And the fact is, there was the menstrual flow. Okay, so now it's actually not a real menses. It's kind of a pseudo menses, something that looks like a menstrual flow, but it's coming every month. So in her case, that was what happened. And then the last time she went to that clinic, like after about 9 months later, she got there and she was having severe abdominal pain, severe one. So when she got there, the first thing that came to the mind of the medical officer was appendicitis. Okay, but with the kind of pain, like it felt like it was contraction. So they just decided to check her cervix, and she was already 6 centimeter dilated. So the best thing they could do, in fact, before they could just know what was happening, she already gave birth to a baby girl, a baby girl. So for her, in fact, her mom what is a nurse, so she was really shocked when the school invited them to say your child has given birth. Even the young girl refused to touch the child because she said she was seeing her period. There was nothing that showed that she was pregnant, although that she noticed that there was a little change in her weight, but that was not enough. Every other thing proved that things were normal, like there was no other sign. So the parents were shocked because the mom is a nurse and she could not imagine how her little baby went on with pregnancy for 9 months without her getting to know until delivery. So that was how that case was. Even the person responsible, the young man responsible for the pregnancy, also was denying. Ashton Sakatu, yes, your testimony is on the way and you will receive it. Everybody who is believing God for this testimony, you're going to receive it. So, like the young man responsible for her pregnancy actually was denying because it was a long time ago and the lady never came to say, I was pregnant. Okay, so it was really difficult for. It was a difficult situation, and it was a school that had to invite the whole family to try to settle the case. So that is it. So it actually exists. It's quite rare, but it does exist. So if you feel that you are in such situation, just make sure that you're eating healthy. But like I was saying earlier, generally, as a woman in your childbearing age, always know that pregnancy can happen at any time, and so you need to be cautious. Like you prepare the body deliberately for it. Okay, just prepare yourself deliberately for pregnancy. And you can do that by just eating healthy, eating all the right things, exercising, avoiding stress. Now, I always say if you're in a toxic environment, it is going to be difficult, because what stress is not the same as exercise. Exercise is meant to help blood flow, but stress is going to release a hormone that is contrary to the normal functioning. 6 years, Monica, have you gotten a no? Not yet. I've not really. I've not gotten any case of 6 years yet. The highest is 2 years, and for her, we are still trusting God, because I know, like, she has so much confidence, she has so much belief that it is going to happen. So I know that God is going to make it happen. So I just trust everybody. Saka, do people think we are crazy? No, not at all. Not at all. Not at all. So that's almost 2 years. For everybody, just hang in there. Just hang in there. And like I said, just make sure that you're doing all the right things. All the right things. Check your blood pressure from time to time. Check your sugar level from time to time. Don't um just assume that everything, you just wait for chance, like just leave everything to chance. No, like all the people that have reached out to me, they didn't leave it to chance. Like they were trying, even though nobody was actually believing their story, they kept trying. What can you say about some Nigerian midwives asking for millions to induce the baby? It's a lie, oh. It's a lie. That one is a big lie. Okay, anybody telling you to bring millions induce the baby just want to arrange a baby for you. So don't ever fall into their trap. Don't ever, never ever, don't ever fall into their trap. Okay, because now there was a situation that I talked about in one of the videos. I don't know if you saw it. This particular lady have been trying for a long time, and so like it's a maternity home, and they actually asked her to bring money, and they're going to induce her so time. So what happened was she was actually attending that place with her husband. So it was not as if she was going alone. She was attending with her husband. So it continued, they kept going, they would just be giving her injection and all that, that when the time is closed, the child is going to surface. So she continued going there with her husband. So all right, so everybody's actually get a testimony. Danielle, everybody. Can one go for C-section? Monica, I will advise you hold on. You just wait. Okay, is to wait. So long as it's there, you're definitely going to fall into labor. You're going to fall into labor. So you need to patiently wait. Okay, and for those asking for millions to induce, like I was saying, this particular woman actually fell for the trap of those midwives. They are actually not real midwives. They are scammers. They are big time scammers, and they use that to make money off people. So this particular lady was not so lucky. By the time they asked her to come for induction of that delivery, she was sedated, like that. She slept, like they made her, they sedated her, like gave anesthesia, so she slept. And by the time in fact, in that case, they actually performed the C-section, got a baby, and when she woke up, they gave them baby, like husband and wife. They were very happy that they have gotten a child after a long time. Of course, she was pregnant, and they kept injecting her to make her feel pregnant actually, and they told her it was cryptic pregnancy. So everything was fine until the child started falling sick. Every time the child was just falling sick and falling sick and falling sick, so they decided to do a genotype, and the genotype showed that the child was SS. It was a sickler. So when that happened, the husband felt like the wife had gone out to cheat, because the husband was AA and the woman was AS. So it's the only interpretation is that the woman has gone out to cheat, and that is why that happened. So it became an issue. He wanted to leave, so he just sold off their property so he can just travel out, because he felt the woman disappointed him. And so she had to open up to the sister-in-law that this was what happened, and the husband was always there with her. So She didn't go anywhere. Those people actually told them to come. They were going to induce her and give them babies. And at the end of the day, they did that. And she felt like it was her child. Like she didn't do. And that was how they got to know that that child was actually arranged for them. It was not her own biological child. She was never pregnant. There was nothing like that. So what they did was to arrange a newborn baby for them. I think it has to relate with all these baby factories that are being run here and there. So they just give you a date that coincides with somebody's delivery date, and then they arrange the babies and bring. So that was what happened. And when they tried tracing back the maternity home, it has disappeared. They had disappeared into thin air. So we have to be very careful. If anybody asks you to bring millions so that you will be induced, the child will be brought forth, please run away. It's not true. There's no such thing. If it is cryptic pregnancy, even if it is 1 year, if it is 1 year plus, you are definitely going to bring forth that child. Okay, I've heard testimony. This one is not even cryptic pregnancy. There was baby born, but that lady didn't give birth for almost 2 years, and she eventually put to bed. A lot of people were thinking the day she was going to put to bed, she was going to give birth to a monster, maybe one dragon with hair and all. She brought forth a normal healthy child at the end of the day. So the body is very tricky. That the human body is so complex that you cannot completely understand it. Even the doctors that have been treating health worker, you cannot completely understand it. That is why it gets to a point, and then you just say it is God that knows the final. Trust me, because there are situations you go to the hospital for, and everybody is just lost for what they don't know what exactly is your issue. But trust me, when the time is right, everything is going to happen accordingly. Because for this couple, it happened. It was like a joke. I am so excited. Like, I am very grateful to God for them, and I know that for every one of us that are trusting for the same thing, that feel that, like, I always say maternal instincts are very strong. That is why you are somewhere, you feel your child, something's happening to your child, and then you just feel it. You just feel. That's why they say women are very emotional. You feel it, and it's actually what it is. So please don't forget to give this video a thumbs up and share, because so many women, it was when I started talking about this, I noticed that so many women are going through it. And I actually started talking about it when this scam issue happened, this particular woman, when her own happened. So I believe the carrier can go for the elective CS if it is more than 5 years due to inpatient and troubles at home. You can actually try that. But one thing is the fact that the hospital most times do not even believe. Like, for the fact that there's a negative test, negative ultrasound, they do not even really believe. Like, the medical team might not believe your case, might not believe your story, might not believe what you feel. So even when you request for CS, it might be difficult. But if at the end of the day they accept to say, okay, we can actually go in, even if it is not just CS, they can do an X-lab, that's exploratory laparotomy, just to explore, to check all the things that are there, and then to know, to see if there's a baby, and then they get the baby out. So that is it. But one thing that I need us all to understand is we should be very careful. No matter the condition, make sure that you are confident in what you feel and you're waiting for the right time. Don't allow anybody trick you into doing the wrong things. Don't ever allow anybody to trick you into doing the wrong things. The fact is, there are so many options that are available to us now. It is not like the olden days where there are no options. There are several options that are available. There is IVF, there is IUI, and there is IU, and there are other options too that are available. So trust me, you can always get that child that you want when the time is right. They want to give me a colonoscopy to see if I have ulcers. They don't believe it's a baby. Oh my God. Just hang in there. Trust me, just hang in there. If it's a baby, it is definitely going to pop up. Okay, so you don't begin to undergo procedures that might actually affect the growth of a baby if it is actually there. So just hang in there. All right, hang in there, eat healthy, and do all the right things. That is what my advice always is. So that is it. If you have any question, any contribution, any comment, feel free to always drop. Monica, can the X lab see the baby? Feel free to always drop your comment. Now, X lab is actually a procedure that is conducted where to actually, when you say X lab, is to explore, they check where there are abnormalities in the reproductive system. It is taken out. Now, for people with um, ovarian cyst is X lab they do, especially if it's a hemorrhagic cyst, a cyst that is bleeding, they'll do X lab. If they do not really know what is happening, maybe they scan said stenosis, uterine stenosis, and all different forms of diagnosis, they will just open up and explore to check whether everything is in order or not. Okay, so they can, if they open up, of course, if there is a baby there, it is definitely going to be picked up. That is the fact. If there's a baby there, it is going to be picked up through an X lab. All right. So the main my issue is the fact that not every gynecologist, not every healthcare provider, not every doctor might want to go for the X lab, except of course if you decide you want to do it and um you are ready, and then your doctor understands with you and decides to do it for you. So basically, XLab is actually exploratory laparotomy. They go in there, they explore, they take care of whatever abnormality they see, and that is it. So that is it. And like I said, always ensure that you're checking your blood pressure regularly, you're checking your sugar level regularly, and you're taking all the right vitamins. That is very important, because some of the complications of cryptic pregnancies are pregnancy scan is always seeing fibroid. So if the fibroid operation is going on, I believe they can say, yeah, of course, if they open, if it's a pregnancy and it's in the womb, when they open the womb to remove the fibroid, they're definitely going to be seeing the baby right there, because the fibroid usually grow inside the womb. Okay, so the surgery for fibroid is myomectomy. That's removal, excision and removal of the fibroid. So of course, it's in the womb. So if they open up the womb to take out the fibroid, they are going to definitely see the baby if it's actually there. Now, I usually encourage people, like, if there is fibroid, don't hesitate. If you've ever been advised that, oh, you have fibroid, come and remove it, don't hesitate to go to remove it. Now, several testimony. I had a friend who was having some form of infection. She felt it was infection. That was shortly before her wedding. She reached out to me to say, I feel like I've been having infection. I need treatment. I'm like, you need to do a test, okay, and then a scan, and then we'll know what is there. So she didn't do that until after her wedding, and when she got to she did the scan, they discovered she had fibroid, multiple fibroid. When multiple is plenty, like so many fibroid in her womb. So the husband didn't want to accept that. They were just newly married. They've not even had any issue yet. So they were praying. It was prayers, and then pastor was praying for them and told her, you don't remove, if you remove it, you'll not be able to conceive and all that. And so she decided to go with them. I kept encouraging her, just get to the hospital, remove this fibroid, but she wasn't taking it. And as time went on, her stomach was getting big, and people were congratulating her. Congratulations, congratulations, God is faithful and all that. So at the end of the day, she discovered that she was just losing weight, because most times with fibroid, you're going to be getting, Monica, you are welcome, you're going to be getting heavy bleeding, heavy menses with clot and with severe pain. So those are some of the things that fibroid will do. And that blood you're losing can cause you to develop anemia, like low blood level in your body, and sometimes you begin to think about needing transfusion. So in her case, she kept losing blood and she kept losing weight, and her stomach kept protruding as if she was pregnant. And people were congratulating her, but she reached out to me after a long time. I was like, this thing is not going, this is my situation. And I insisted, I said she should please go for surgery. At that time, the husband had left. The husband got um um something abroad and left, and so she was here. I said go for surgery, and so she agreed, went for all the investigations, did everything, and the surgery was done. Of course, she had blood transfusion because she had lost so much blood, so she went for the surgery. Yeah, it's actually good. So thank you, Diamond. It's really good to know that people are experiencing it and people are getting results. So she actually went for the surgery. The surgery was successful, and after the fibroids were removed, few months later, she reunited with her husband in the UK. And as I speak with you right now, she has given birth. So she has given birth. Like as soon as the fibroid was removed, pregnancy was express. Because one thing fibroid does is that they just occupy all the positions that babies are supposed to occupy. And then even when pregnancy happen, miscarriage, because they will choke the baby, they will be eating what the baby is supposed to be eating. Trust me, these fibroids are eating the things you're eating. That's why they are growing and multiplying. So when they are there, they are growing, they are getting nutrient from you. So when you eventually get pregnant, instead of your baby to be getting the nutrient, the fibroid is the one swallowing all the things. Do you understand? My friend's neighbor recently lost her 6 month pregnancy because of fibroid. They choked the baby to death. The funny thing was the fact that she came for antenatal that day and went home. And then in the night, she started bleeding profusely. And when she was rushed in, an emergency C-section was performed. The child, of course, didn't make it. And the fibroid could not be removed immediately because of the fact that she was bleeding so much. If they cut the fibroid again, because normally when there's an excision of fibroid, the sorry normally when there's an excision of fibroid, there is blood loss. So of course, she could not actually they could not remove the fibroid, so they closed that up, and then she was advised to come after 6 months for the fibroid to be removed before she starts trying to conceive again. So if you have been told there's fibroid, please just submit for surgery. Trust me. And I remember, before I actually oh my god, somebody just keeps calling. So before I actually really got to study about this, I used to also feel like if you do fibroid surgery, you are not going to be able to conceive, but that's totally not true. So if you have fibroid, you've been told at all that there is fibroid, please go for removal. Because I discovered that most times when all these things are removed, like the chances of pregnancy is very high. Several testimonies that I've gotten, like people with hemorrhagic cyst, after the cyst is removed, they just get pregnant. People with different, reproductive tract condition, immediately it is removed, they just get pregnant. So, but if you're okay, there's no issue. All you need to do is just to be taking your folic acid every day. I cannot emphasize it enough. Just be taking it every day, every single day. Just be taking it, and make sure you're eating healthy fruits, vegetables. You'll be avoiding junks as much as possible if you're trying to conceive. So, and except of course, a life partner has not yet come, or maybe you're pursuing career and you want to finish before you begin to get pregnant, the best times to actually have your babies with ease is the early 20s to the late 20s and the rest. As you begin to advance in age, the chances begin to reduce because the quality of the egg is reducing, and also the chances of getting pregnant is also like the chances are also reducing as well. So if for any reason you have the time, you just need to get pregnant, so you share it. There's a young girl, there's no point, just have your babies and you will just rest, because I tell you, you're not going to be fertile all your life. It's very fertile all your life. It keeps declining and declining and declining. So we need to make sure that we are working with our biological clock at every point, and to make sure that we are doing the right things. Okay, so if you're trying to conceive, it's not just about you. It's good to hear that. Okay, hello, beautiful host. Mercy, hello, nice to have you. Thank you. Okay, so if you're trying to conceive now, it's not just about you. Most times, we women always see it like it's just about us. But sometimes, even your partner too needs to do some work, okay? They need to also go for check to see if their sperm count is okay, if their sperm quality is okay, if everything is in order, like the motility of the sperm is in order. Diamond be trust me when I say, trust me when I say, like the body functions differently. That won't be your 46. Trust me, there are people that are even older, like 47, 48. They just try pregnancy just jumps in. So that is why the our systems will fail us sometimes. Like the knowledge we think we have, the body will work in such a way that we'll be surprised that these things happen. And that is why you continue to just eat healthy, live healthy, and continue to take your folic acid. I told a colleague the other time, a church member, she's already approaching 40, she's not yet married, and I was encouraging her that she should continue to take her folic acid, she continue to make sure that she's living healthy, exercising, because she definitely wants to get married and have babies. And of course, if she everything is right and her systems are in the right shape, when the time comes, it's just going to be a walkover. I think it was today I read about the 51-year-old woman who just put to bed. So that is it. Like the body function in very surprising way. So that's it. So like I was saying, your partner should also do some check the sperm count. Let them check the sperm quality, the sperm quantity, the sperm motility, the sperm morphology, so that everything is also in okay, because in order, because you might be producing the right amount of eggs, you might just be producing all the right things, and the fact that your partner's sperm is not in good order, you will not achieve what you really need. Because even when the egg is released, the sperm cannot speed, because the motility, that's the speed, is slow. It cannot run very fast to go and catch up with the egg, and so the egg will become non-viable, and that cycle will just pass. But if your partner goes for test, and he's checked, and then help is given if at all there is low sperm count or something, or poor sperm motility and all that, he will be treated and everything will become fine. So, and them too, they also have things they can eat to build up, make their sperm quality higher, and also increase sperm quantity. Okay, things like walnut, even banana, eggs, and rest of them. You can be giving that to your husbands from time to time. All right, so that is it. So basically, I want to just encourage everyone on this platform who is battling with the case of cryptic pregnancy. I want to encourage you to hold your head up, do all the healthy things, and just believe God to answer you. And for everybody who's trusting God. Now, when we talk about people that are trying to conceive, TTC, it's not just about people that have never had babies before. Now, if you desire to have 4 children and you've had two, and then you're finding it difficult to have the third one, you are TTC. Although you are secondary TTC, okay? That's secondary infertility. The primary infertility is for those that have never conceived before. They are trying, but pregnancy have never been achieved. So it is on different levels. For those that have never achieved pregnancy before, it could be due to so many things like tuber blockage. Sometimes there is endometriosis and all the different things, PCOS, polycystic ovary syndrome, that is usually associated with irregular period. You see your period today, the next time you're seeing your period is in 2 months' time. You're getting lots of acne. You have like sometimes you have male features like the bears, and then some other like deep voice and the rest of them. So you discover that ovulation in that situation will be difficult. So in that case, it will be difficult to conceive. But for secondary infertility, if you've actually had babies before and all of a sudden you cannot have babies again, it could be due to infections. Maybe since after you had your other kids, you've developed infections that have impacted maybe your fallopian tubes and then has caused blockage. Or for some, maybe you had cesarean section. It could be due to some adhesions from the surgery that is now making it difficult for you to conceive. And then sometimes it could be due to maybe endometriosis you developed later after you've conceived your other children, and then sometimes hormonal imbalance. Now I've had women complain that all of a sudden their hormones are no longer, they're no longer getting regular period, especially for those who had been on family planning. Okay, so many of them, so many have reached out to me that currently we are working on how to see that their cycles are regulated. Okay, so they went after one child, they went on family planning, and by the time they decide to have babies, it is now difficult for them to begin to have those babies. So their hormones, like their menses, are no longer regular, ovulation is no longer regular. That's after they went off the family planning method. So we are still trying to work at it. All of that are secondary infertility because they've had babies before, but now it's difficult to have babies. So in all, like, every woman deserves to be happy. Like, everybody deserves to be happy, and trying to conceive is a very big issue. Like, it can take a huge toll on your mental health, and that is why I try as much as possible to encourage anybody who reaches out to me to say, I feel like I'm pregnant, I have all the symptoms. I try to encourage you, because the truth is, only that the period of trying, it's a huge one. Like, I wrote on my page yesterday on Facebook, I have 2 kids, but I still get asked when I get to work, and they're like, your kids are 4 years, when are you going to give birth to another one? And why are you wasting time? So I'm like, I have 2 already. So, and then I'm getting all of this, when. So how about the other colleagues, the other people who do not even have anyone yet? How do they get to cope? Like, how do they feel? So I feel that we should be agents of change. We should be sensitive to the needs of people. If you see a woman who have not yet conceived, trust me, most people are actually trying. Like, they are trying, they won't tell you. So we'll be very, I don't know, we should be very careful with all trances. Like, be very careful with the utterances you make, the things you say to them. And because you don't know what they're passing through at the moment, you don't know the exact battles they are fighting in the closet. But a lot of people are not sensitive to the plights of people, and they just ask things, they just say things anyhow. But that's completely wrong. So, and also, for everyone who's trying to conceive, please make sure you understand your ovulation, you understand your fertile window. Yeah, people should respect boundaries. Yes, Mercy, I tell you, in this our African society, people don't respect their boundaries, or they will tell you to your face. When 3 months, I got married in April, I conceived in August. Within that 3 months, I heard something like somebody will look me in the eye and say, since you got married, you're just getting fat, eating and adding weight, and you're just eating alone. You will not go and get pregnant. Eh? Like, it was not funny. People don't mind, they don't respect boundaries at all. They just say things the way it comes to their mind, not even minding what people are going through. So, like I was saying, you just try to understand your fertile window, your ovulation period, the best time to try. Okay, so that is very important. Like, for the women on my WhatsApp group where I talk, like, they will just share information and everybody just bring their ideas. A lot of them are conceiving because most of them never understood what their fertile window was. Some people didn't know what their ovulation was. They didn't even know how to calculate their menstrual period. So you just start counting from the day your period started. So everybody watching, if you have a calendar, as soon as the day your period start, just go and tick it, just circle it, and then till the day the next period starts, circle that day and then count it. Do that for like 3 months. You'll be able to know that this is your period. And once you know that your period is 27 days, is 28 days, is 30 days, you'll be able to now begin to know how to calculate your ovulation period and then when to conceive. Okay, so when you understand this, it becomes a whole lot more easier for conception to happen. So, and normally, as soon as conception happens, the menstrual flow is supposed to cease. But for some persons, it is not like that. Like I talk and I use real life situations. Like I work in a hospital, so, and even colleagues, I have a colleague that was menstruating for 4 months. Like she didn't get a positive pregnancy test. She didn't get, like, she kept seeing her period, and her pregnancy test was negative until the first time she was able to know she was pregnant was when she went for an ultrasound at 12 weeks. She did that ultrasound and they saw a baby, but she was getting her menses and the pregnancy test was negative. It was after they saw a baby on this ultrasound, they tried again to do a test and it came out positive. So this is a colleague in the hospital, so it's not a random thing. So of course, when you get pregnant, normally the menses should stop, but there are individuals that are different, like the systems are different. Most times when you talk, you hear people say, I was menstruating, like I was bleeding for 4 months, for 6 months with my son's pregnancy, and I eventually broke forth. So there is a standard that the regular literature, the regular medical literature will tell you, but there are ways that the human body, the woman's body, will act that will just be contrary to what the medical informations give, and then you'll just be surprised. And that is why I listen to everyone. I do not doubt any symptom anybody feels. Like I just understand what you feel, and then I just put myself in your shoe at that moment, because I know for sure that there are exceptions to some rules, and that is just the fact. There are exceptions to rules, because I had a patient who came in with stomach pain. She had already seen her menses. Like, it, because of the severity of the stomach pain, we decided to do an ultrasound, and there was a baby. Okay, and she had seen her period already. So there is nothing that surprises me when it comes to diagnosis, especially with women and their reproductive system. Nothing really baffles me again, because there are so many things that we have seen that really makes things a little bit plain to me. So for people with cryptic pregnancy, you continue to just get that period, like a pseudo period. It's not a real period, because normally as soon as pregnancy happens, the menstrual cycle ceases. Okay, there's luteal phase, menstrual phase, ovulation phase, and all that. But as soon as pregnancy happens, there's no longer going to be that menstrual phase. So whatever you're getting is the uterus shading off little bits of its lining, and that is actually not menstruation. It is more of bleeding, but it's something that looks like menses, and that is what women with cryptic pregnancy get. And a lot of times it's difficult, like it's difficult to really tell exactly what is going on in the bodies of these women, due to the fact that that period keeps coming, the pregnancy test is negative, and then scan also is not picking it up. So basically, I want to encourage you, or just hang in there. I'm so grateful. Like, what brought me, actually, you all know, I'm so grateful that this family have testified. Okay, when they reached out to me, earlier, it was not funny. The husband was worried, the wife, they were just worried because of their situation. And to God be the glory, the woman has put to bed. Even though everybody didn't believe her, she has put to bed. And I'm very grateful to God. So hang in there, everyone. I wish you all the best of luck. I wish you the best of the new week. For every woman who's trying, baby dolls to you all. Your rainbow babies are going to be in your hands very soon. So thank you all for staying. If you've not given this video a thumbs up, just give it a thumbs up, share, drop comments, drop your question, drop your contribution. I will really love to respond to them because I believe your story. I believe everything that you say. I do not doubt you at all. And I wish you the best of luck. I can't wait to hear all your testimonies. Like, my ears are open wide to begin to hear everybody's testimony. I can't wait. And trust me, we're going to be celebrating. The more the babies are coming, the more we'll be celebrating. So thank you all so much for watching. Let me know your thought. Let me know what your contributions are. And stay with me. Will, if you have any question, I don't know, maybe I'll be dropping polls on the community tab, community post. I'm dropping community posts so that I can be getting live. Thank you so much, Daniel. You're welcome. Thank you so much for staying. So I'll be dropping posts there to know how often you would want us. Okay, I'm so ready because my life is not the same. Of course, be ready. Everything is going to be falling into place. So it's going to be raining babies. Trust me, just hang in there. So I'll be dropping. So I know when we'll be coming on live. So you get your questions ready. You get your contributions ready. So anytime we come like this, we discuss as families. If there are anything that bothers you, you bring it up, we'll talk about it. If you need to even join me on the live like this, I can invite you to the live and you join and we'll just talk. We encourage each other. We just lift each other's spirits because we are a tribe, like we are women and we should help one another because trust me, women are going through a lot and we are supposed to be let me say the shoulder that everyone of us can lean on from time to time. So thank you all so much. Thank you. Okay, Danielle, I'm going to be going live more often. I'll try as much as possible to be going live more often. So I trust that it's going to help us to be more, to interact more and get to know each other the more. So I'm going to be going, I'll try. I'm definitely going to be meeting that request. I'll be going live more often so that we'll get to talk more and more. So I really appreciate you all. Don't just hesitate to write me questions. As soon as I get your question, trust me, I'm going to respond to it. And please, if you have a woman around you who needs encouragement, don't hesitate to give them that shoulder to lean on. Please don't hesitate to do that. I have so many of them around me who are going through a lot, and I don't hesitate to, tell them and encourage them. And that is why I'm very careful with the words I say to people because I feel like it can leave lasting impression on their minds. Because of course, you might not know what somebody is going through in the closet. This woman you're just telling, you don't want to get pregnant. That person might have been trying for years and not achieving conception, and then you just feel like she doesn't want to. Like, as far as you are married, you and then you plan to have babies, of course you would want to get pregnant. So let's be source of encouragement to other women around us, and let's continue to pray. Now, I am a child of God. I know we are all children of God. And Psalm 127 verse 3 said, children are a heritage of the Lord, and the fruit of the womb is his reward. So that is one Bible verse I hold on to very dear because I feel like children are God's heritage. When I got married, I just told myself I loved twins. My husband said we loved twins, and God gave us twins as first, two boys. So I was always reading the scriptures and I was putting them everywhere in the room. Children are a heritage of the Lord. The fruit of the womb is his reward. It is my reward from God, and nothing will take that away from me. Nothing. So I believed so much in that declaration. I believed so much in the fact that God is actually going to give me my reward because it is a reward from him, and of course I deserve it as a child. So as a child of a man, you are entitled to his inheritance. So of course you will get your inheritance definitely. So that was one thing I had strong, and I kept declaring. If you see my bedside, I did a cardboard. I so many cardboard. I designed them and I wrote all the things I wanted. Okay, my children will soon come. My children will surround my table and all that. And then I kept believing in that declaration. When I got pregnant, we got to the first scan. In fact, I was not keen about scan at all at first. When we went for the first scan, the sonographer was like, Madam, it's triplets. That I could see a third sac, but I was like, check well, oh. So he checked again and he was like, the third one is not very visible, so we are going to rescan in a week to be sure. So the first ultrasound I got was viable twin gestation queried triplets. What? So my husband was like, don't get too excited, let's go and confirm somewhere else. When we got to the next place, the first question, the is that one is a consultant radiologist. He just asked me, say, Madam, how many children do you have? And then I was like, I don't have anyone, these ones are my first. And he was like, what? And you just, there are two. And then he called my husband in and he was like, Oga, you look so innocent, how come? So that was how they came. That was how they came. I didn't know if there was any twins in my lineage at the time. There was no such thing, and that was how they came, and it was smooth. So I believe that every heart desire that you have can become your testimony. It was a desire. We loved them. People kept saying, if you are liking them, they will not come to you. If you love them, they will not come to you. We loved them and they came to us immediately, like our first. They are 4 years old now. So that's why I want to encourage everybody. Don't give up. Don't feel depressed, because the moment you're beginning to feel depressed, the moment stress is setting in, the body is not going to act properly again. So you would make sure to relax your mind and make sure that you are in the center of the will of God, and then just continue to declare on your womb every day, and just trust the process. You will definitely have your child. Okay, and whatever position you are right now, if you're feeling pregnant and all, just hold on to the promise that it is going to turn out for your good. And trust me, it is definitely going to be turning out for your good. And that is what I believe, and we are all going to testify soon. So I wish you all the best. It's the beginning of a new week. Feel free to ask me any question at all that you have. I am open to suggestion. I am open to questions. I am open to contribution. Just feel free to drop your question. I'm going to definitely be responding to them. If there's something that a pressing question that you have a pressing question, don't hesitate to ask. If I cannot answer it, I'm definitely going to be talking with other colleagues. There are consultants, there are other medical officers, there are nurses that are higher rank than me, people that have had experience all their lives, and I can always um table your questions before them, and they're definitely going to be responding, and I will get back to you. So that is it. Feel free, if you have something you need to say on any of the live videos, I'm going to bring you on as well. So thank you all. It's the beginning of a new week. I wish you all the best. I pray that all your heart desires will become testimonies. But if you don't know how to calculate your ovulation, that is where it's starting from. Menses, menstruation, and ovulation. So you first of all learn how to calculate your menstruation, like your menstrual cycle. When you know that, then we'll now go to how to calculate your ovulation. Then when you know that, we'll now begin to talk about how to now boost ovulation, things to do to know, so that you increase the chances of um, quality eggs being released. And then we'll now talk about signs to be able to know that, okay, you are ovulating. Like I always say, you take the pregnancy ovulation test. The ovulation test kits are not very expensive. You can get them online on Jumia if you're here in Nigeria, or on Konga. You can get it on Amazon. It's just like the normal pregnancy test strip. You dip it in the urine, and then you see when you begin to get two lines, it means you are ovulating already. And by the time you're getting the sharpest line, it means the egg is coming, is coming, is coming, is coming, is coming, and you need to begin to try. just start trying immediately. So that is what you're going to do. Just start trying, and then you'll be getting the fertile cervical mucus. Thank you, Live with Danielle. You are encouraging me so much. You'll be getting the fertile cervical mucus. Like I said, there are discharges all through the circle, but the one during ovulation is that egg white, like it's just egg white, like it's not it doesn't have any color. It's just transparent and like that egg white. Some, if you hold it like this, it's going to like, it's slippery kind of. Also, if you're monitoring your temperature, you will discover that there is a period, during the ovulation, where your temperature will just rise to rise higher than it has been in the months, in the days before, and then you know that ovulation is already happening and all that. And then sometimes you're going to get breast tenderness, but trust me, breast tenderness usually come when the egg has been released. So by the time you're getting that breast tenderness, the egg ovulation has happened already, like the egg has already been released. So that is why you're getting breast tenderness and all that. So you need to always check for that. And once all that is already in place, the next thing is just to be trying and then be believing and trusting God that it is going to happen at the perfect time. And try and try and try not to get disturbed by whatever people are saying or whatever people are doing. And one thing that I pray for everyone is that you have a partner that is supportive, you have a partner that's understanding, you have a partner that stands by you through thick and thin. And also just try as much as possible to live your best life. And as a woman, just make sure that you're doing something to make you a little bit independent. All right, aside the fact that your husband will be doing something to make you also independent, so that as soon as you get pregnant, you'll be able to take decision as regards your health and the health of your babies as well. I'm going to be bringing up some of the situations that have happened in recent time. The last one that I got on Friday was a woman. She was actually attending a facility and she was already due for delivery. Blood pressure was so high, like the baby was already in distress. Now, the hospital didn't even ask for a dime. They decided to rush her immediately to the theater for an emergency C-section, but the husband refused. He said no, he didn't want the C-section to happen. He doesn't have money. They are not requesting for money. We want to save the life of your baby first, but he felt like maybe it was just tricks to take money from them and all that. And then he took the wife away. And after some time, they went to another facility. And when this C-section was done, the child was brought in dead, was brought out not no longer alive. So now what happened was the fact that the man felt that that they want to take his money and he didn't want to pay, so he took the wife away. But for the woman, if she had the money, if she had her own means, she would have said, I am not going anywhere, I'm going to have my baby, I will pay my bills and all that. So I encourage every woman to try as much as possible to have some independence, so that when such situations arise, you'll be able to save yourself, because so many of such scenarios have been happening lately in our facility and is not good. Okay, so some people just go to deliver with um quacks in the chemist, and then they just bleed to death with the pregnancy. So all of this, so I encourage you, as you're trying to conceive, trying to track ovulation, trying to track fertility and all, also be trying to be financially independent as well, so that you can take decision regarding yourself and your baby at any point. Because as soon as you get pregnant, it's no longer about you alone, it's about you and the life that is growing inside you. And you need to take that very seriously. You need to take deliberate action to make sure that that life is brought out. Now, I don't know. So even for health personnel, it happens to them as well. This negligence of our health and all that. Okay, so there are people that have tried for years with hormonal imbalance and all that. So they have tried for so long with all this, and then they get pregnant eventually. Their post date 42 weeks, and refusing to submit for cesarean section. Labor is not coming and they're refusing to submit for cesarean section. And then they have um until the whole liquor, like the fluid that is surrounding the baby, everything, amniotic fluid, everything dries up. They bring out the baby, and the baby do not make it. Like, please, we need to take responsibility for our health and try as much as possible not to risk anything that has to do with our health, our reproductive health, and all that. So I want to encourage us all. So we'll continue to see, we'll continue to discuss, we'll continue to interact from time to time, and we'll get to know all the things that we should not do when pregnant. If your blood pressure is high in pregnancy, it is a red flag. Just make sure that you are monitoring it from time to time. Okay? For some, when the blood pressure goes up, they don't even mind. See, like I always say, let's try as much as possible. As soon as you're able to achieve that pregnancy, just know that this time, this 9 months, I need to be as careful as possible. You will be grateful you did, okay, at the end of the day. Okay, you'll be grateful you did. So let's try as much as we can to be careful what we do. If you're trying to conceive and if you eventually get pregnant, just make sure you're doing all the right things and doing them at the right time. So thank you all so much for staying on up till this time. So we'll try and be going live more often. Let me know in the comments when you would want us to go live. I don't know, because there are times I come on live and I don't see people, maybe people are not online at that time. So I think there are specific time of the day where people are more available online. So I'd get to know those periods of the day so we can be doing our live videos at that time. Or maybe we can decide when is the best time for us to be able to meet, and then we'll be doing it so that everybody can be benefiting from it. So you just get all your questions ready, get everything that you want to talk about ready, so that when we come like this, we'll just discuss like a family. We'll just discuss on a general note. If there are other new informations, we'll share, and then we just contribute, and everything will just be flowing. So thank you all so much for staying. I really appreciate you. Thank you everyone. Danielle, Messi, um everybody. I just cannot remember everybody. So I just want to say thank you all so much. We're a family and we just continue to watch out for each other. And I wish you all the best. Meanwhile, please don't forget to give the video a thumbs up. Don't forget to share if possible. And that was going to help someone. And you can also just like, thank you. Bye. Have a wonderful evening and have a wonderful week as well. I wish you all the best. Bye.